So I was recently asked a question, does the brain get smaller as you grow older? And the answer is yes, it does. The brain actually does get smaller, but the brain gets smaller to different degrees depending on the person, right? So this here is a brain of a young person without atrophy. You can see the brain is nice and wet, and it's filling up the whole skull of the individual, right? And up here we can see the brain of an elderly person with severe atrophy. We can see the brain is not completely filling up the skull. Okay, so this is how you can tell the difference. This is a skull and brain of a young person. This is an elderly person. So we know that the brain plays different functions like memory and behavior and controls basically the whole body, right? So if you have a very severely atrophied brain like this one, these patients may present with things like loss of memory, change in behavior, and they're also at risk of having different problems like subdural hematomas and all those other problems, right? So how do you prevent having a brain like this one here? Okay, so first things first, the brain is about 80% water, right? So you need to drink water. Take water frequently. Make sure you are well hydrated. When your body is well hydrated, even your brain is well hydrated. When you're dehydrated, even your brain becomes dehydrated, and the risk of atrophy is quite high, right? If you have things like hypertension or diabetes, make sure you control your blood pressure very well, control your sugar very well, because these conditions tend to reduce the amount of oxygen going to the brain by blocking small vessels, and this will cause severe atrophy over time, right? So if you smoke, people who smoke tend to have low oxygen in the blood, and this low oxygen in the blood would translate to low oxygen in the brain, which will increase the risk of atrophy, severe atrophy over time. So if you smoke, try to reduce or quit smoking, right? And change your diet, right? There's this diet called the Mediterranean diet, right? Sounds like a very expensive diet, but it's basically just eat more vegetables and fruits, right? So take fruits, vegetables like broccoli are very, very good for the brain. Things like avocados, quite good as well. Things like fish are also very important because they contain omega-3, which is very important for maintenance of the nervous tissues and the brain, right? Things like eggs. Okay, eggs have a lot of vitamin B6, B12, and folic acid, which are very important for the repair of DNA. Right? Things like olive oil, whole grains, which are very good with vitamin E, which is an antioxidant. So things like dark chocolate. So dark chocolates also contain things like cacao, which is also an antioxidant, which reduces the risk of severe atrophy. Okay, so you can also, do some activities that encourage oxygenation of the blood and increase the blood flow to the brain. Things like exercise, aerobic exercises are quite good actually. Right, so when you exercising, you are taking very deep breaths, you are well oxygenating your brain, and that reduces the risk of having severe brain atrophy over time. So these are just some things that can help you reduce the risk of getting severe atrophy as you grow older.